In mantle cell lymphoma, typically for young and fit patients, the treatment paradigm is that's commonly utilized would be a intensive cytarabine-based induction therapy, and then in patients that have a complete or partial remission, we would typically consolidate that remission with a stem cell transplant and then do maintenance therapy. But that sort of treatment paradigm has been called into question a little bit because it may not benefit each patient equally. And so one of the ways of sort of determining the utility of autologous stem cell transplant is to evaluate it in a population of patients that are MRD negative or minimal residual disease negative. And that's based on the clonoSEQ assay, which is a commercially available assay and is able to detect malignant mantle cells with a sensitivity of 1 to the 10 to the minus 6. And so that study is actually currently still ongoing. And so we don't have mature results from it yet, but essentially it's taking a population of patients that are MRD negative after induction therapy and then randomizing that population of patients to either stem cell transplants followed by the typical treatment paradigm of maintenance therapy versus randomizing them to the other arm, which is just maintenance therapy. And really, we need to see the results of that to get a better understanding of if stem cell transplant is needed for every single patient. Are there certain populations of patients where it may be better suited for? And by the same accord, are there populations of patients which don't benefit at all from stem cell transplant? And we should maybe consider the application of more novel therapies earlier on, or even potentially the use of things like CAR T-cell therapy earlier in the treatment paradigm for those patients. And so, we really eagerly await the results of that study to get a better understanding of how the landscape is for mantle cell lymphoma is going to change.